I'm Edwin Warfield, the publisher of CityBiz. I'm honored today to interview Ted Quinn, the CEO of Activate Care.
It's good to meet you. Thanks for taking the time.
What were some of your experiences which led you on your entrepreneurial journey to launch Activate Care? And can you bring the role that Mr. Christensen played in the startup?
This is my third or fourth venture in healthcare or in ventures generally. I was fortunate when I finished business school back in 1994 to move into consulting, but then quickly moved into operating roles. One of my first ventures in kind of an entrepreneurial role was under the umbrella of, at the time, a corporation called Determinative, and basically spun out an organization and a team that was focused on trying to disrupt the core of that specific business. And so what was a small team, but over time grew to a team of over 200 engineers and marketing and professionals. We kind of attacked the market with disruption at its core of how could we unseat a kind of a core product that was currently operating within that space. I then transitioned to a number of other small ventures and turnarounds and looking at technology and solutions for patient self-service and workflows for providers, as well as work around robotics in healthcare and how they can be deployed against kind of meaningful needs and operations in hospitals and facilities, and also infection control, infection surveillance, and how do you kind of meaningfully drive solutions that help kind of target those hospital-acquired infections and challenges. I was actually over in China with HIMSS at China back in late 2011, 2012. And I received a call like at 2 in the morning from Clay Christensen over at Harvard Business School saying, hey, I've got these 2 professors in my office, men I hadn't met before, but would come to know as Zach Kohani and Ken Mandel, who are physicians at Boston Children's Hospital and Harvard Medical School. And they were talking about a set of challenges and questions that Clay and I had been talking about for quite some time, about how do you help complex or individuals who are facing complex health and social need challenges navigate the challenges of care or healthcare. Clay was very open about his challenges, and it had become a mission to say, how can I think about with Clay, cancer survivor, heart attack, stroke, a range of physical and challenges physically, saying, I own the problem of Clay Christensen. And we believed that we fundamentally could deliver there was a job to be done here of how could you help individuals and families who are trying to navigate the complexity of a range of service providers that are initially with a real focus on clinical service providers, but over time morphing into how do you think about the service providers that meet the needs outside of healthcare, social services, community-based organizations. And so Clay joined up and then signed up. The 4 of us founded Activate Care, along with Matt Christensen and Rose Park Associates, along with Boston Children's Hospital. And that's launched the venture to what we're doing today of trying to help, as a public health company, help target these challenges these individuals and families face as they try to navigate their care needs, which are so often non-clinically related, but often at the core of how do we see different outcomes that we want to see for individuals and families.
So tell us about your original vision and how you've, as an entrepreneur, had to pivot that original vision from where you are today.
So it's interesting. It's a great question. When we initially started, we were very much focused on the clinical setting. If I go back to just each one of us, Clay, Zach, Ken, myself, each one, and each one of us had kind of a personal experience with trying to navigate the complexities of healthcare for a family member or a loved one. And so we initially said, could we help in a clinical setting, help different practices and groups that were focused on navigating some of the challenges and the interdependencies of clinical care for individuals or patients. And as we tried to roll out this technology back in 2013, at the time, Zach and Ken had released an article called the EHR Trap, where we were talking about some of the challenges with the deployment with the Affordable Care Act and some of the investments that were being made in healthcare, some of the challenges with the capabilities and interoperabilities surrounding the EHR. And so we fundamentally believed if we could deliver a solution that could provide a lightweight solution application to help providers and clinical teams navigate together for their patients, we could move the needle on some of those challenges. But we quickly learned that the EMRs and the promises of the EMR and the role and the workflow of the EMRs was pretty complex. And so as we began to work with our partners, we quickly realized that there are a lot of organizations and service providers just on the periphery of healthcare that provide meaningful services that frankly have no visibility into the team and are often central to the results that we're able to see with individuals and families. That is was kind of at the core of what we pivoted to say, what if we worked in a more structured way to bring those players onto the care team, if you will, and recognize also that families and individuals need a way to engage also. So to provide a shared space where programs and communities are standing up programs like whole person care or long-term services and supports for vulnerable populations. How can we provide a shared space that enables all of those service providers to see each other, to be aware of what the goals are, what we're trying to achieve? We often will say, if everything's a priority, nothing's a priority. So what are we trying to achieve with this individual and family? And how do we move the needle against that goal? And what am I doing and what are you doing? And where are we in the plan? And how do we share that plan? And how do we refer out and invite and get those so central and critical stakeholders that meet a specific need that often resides outside the walls of a clinic or hospital, and let them participate, see the plan, understand as appropriate their role and the information they need to get a service delivered.
So since COVID started, mental health has really has obviously increased in terms of the pandemic. Why is it so important that society address these needs?
Well, you don't have to be touched personally to see it. Almost 4 years ago today, actually just last week, a member of my family took their lives tied to challenges of mental health. So often people suffer in silence and they don't know where to turn, and they can't access resources and supports that help them. And when you have resources in a family like ours, who was aware and working and trying to support individuals going through mental health challenges, it's tough and it's hard. And a lot of people suffer in silence, and those that get help, it's hard to get help and maintain a plan and surround people with the supports they need. And certainly in the environment of this pandemic with COVID-19, there's obviously a significant amount of concern and data emerging to show the implications of the isolation and the remoteness that we all feel. So I personally, as I mentioned, have been impacted by this just in the last few years. And it's become a part of our mission to say, how can we move the needle to provide the resources, to provide some visibility and a plan to people to help them as they try to navigate these challenges. So for me, it's personal, and I see it growing, and I see it throughout my life and the work that I do. I'm a big believer that if you want credibility in helping people through these challenges, you have to do the work. And so even though I sit in this chair and my role right now with Activate Care, I actively try to work to support individuals who have specific needs, mental health needs and challenges, food insecurity challenges, housing challenges. I try to do the work so I have some credibility when I work with some of my partners and they talk about some of the cases or situations that they're facing. I have some perspective and experience to say I've seen something like that, or let me tell you what I've experienced. It's very, very meaningful.
So I usually don't coordinate my interviews to books that I'm reading. There's usually they're not synced at all. But I'm reading Terry Cheney's book called Manic, a memoir.
Okay.
As she was bipolar, had numerous suicide attempts. I would highly recommend it. It's a wonderful book. I'll forward that to you.
Thank you for the recommendation.
So what social determinative health do you feel are most correlated to mental health issues?
If we look at the work that we're doing today, what we have found is there are three common social determinants that kind of associate with mental health. And those are housing insecurity, isolation, and in-home supports, kind of related work. And third is food and access to nutritional. And so as you look at a number of the programs that we work with around the country, they try to target those specific issues. These communities recognize that they can't do everything, but they often bring together a set of stakeholders within communities that are, let's use homelessness as an example, recognize that if we can move the needle and get somebody housed in an environment to get more security, that they see these other challenges around mental health, food insecurity, appropriate supports, fundamentally shifts and changes. And so from our experience, those are the three most common or biggest drivers that we see around mental health with social determinants.
Can you give us an example? I was reading about your example with Marin County.
Marin County, probably 18 months, 2 years ago, began to partner with us as a community. They had assembled a set of stakeholders across a range of services. They pulled together housing authorities, the corrective or jail system, and other supports as part of that. They pulled together the local payers. They pulled together local delivery systems like Kaiser Permanente and others. And they basically assembled a team to try to tackle this issue for the county. And it's, as you can appreciate, it's heavy lifting and a significant amount of coordination. And our role, gratefully, has been able to provide a shared space where they can develop, track, measure, and report on a community plan around all these individuals. And it's really inspiring. Many of these whole person care programs across the state of California and other locations around the country, like Built for Zero programs in different kind of communities, have really seen some incredible results. But Marin has been a great partner for quite some time and have really driven the needle to really address a lot of the challenges around homelessness and its implications for these other topics we've been discussing.
So has Activate Care seen high results in decreasing these factors? And again, walk us through some samples.
You bet. So a lot of the different partners, so if you look at something we've just been talking about, like Marin County or Humboldt County, another county in California, or some of the work being done by Advanced Health in Oregon, some of the work that is being done here in the Boston area, in the Massachusetts area with these long-term services and supports, they're driving down homelessness and addressing needs in levels of 80, 90% improvements in terms of what they've been seeing previously. So that housing security then has driven implications for things like hospital readmissions or number of visits to the emergency departments. And it's really been exciting to see how this translates not only to the quality of life and the experience that these individuals and families are having, but also on the cost of care and the implications for the cost of care for all these individuals and families. And obviously for the communities like a Medicaid or a Medicare program.
So where do you see the trajectory of mental health headed in the next year?
And I don't have a crystal ball for this. I think the first question is, what are the implications or what's the trajectory with this current pandemic? And what are we going to see over the course of this fall? We're seeing some upticks in different parts of the country and certainly in other parts of the world. And I think this isolation and this disconnection that many people are feeling in different parts of the country from each other is a big driver of mental health or mental health challenges that people are saying. So on one hand, I'm not sure how to predict that because every trajectory or the data that we read from the news and the papers that we try to track shows that Pfizer and Johnson & Johnson anticipate results in Q4 of this year around a vaccine for this virus. And so I think the real question is, how does that trajectory work? And what does it look like over the next 3, 6, 9 months as a country? Because until we have better visibility into how that rolls out, I think we're going to see ourselves in a similar situation. You can use a corollary that it's anticipated that homelessness will increase by 45% over the course of this year or by the end of the year. There's an interesting correlation with homelessness and mental health related issues and some of the challenges of that. And so until we're able to target a vaccine and get that deployed and scaled for mass production and distribution, I think it's an open question for us that it's hard to project at this point. But certainly the early indications and data that we're seeing suggests that we should see something by the end of the year, fingers crossed, as that rolls out over the course of the first half of next year. I think that's going to really bode well for us as a communities and as a country to help better address mental health related issues that we're seeing escalate also.
Can you tell us about the platform benefits? Who benefits most from your platform, and who are the professions or organizations that are typically using Activate Care?
If you look at care models around the country, there are a number of players that are convening or coming together. Insurance or payers across the country, delivery systems and hospitals, and as we're talking a little bit here right now, community-based organizations. And then, of course, the fourth leg of the stool are individuals and families. The latter two players or stakeholders in that kind of community are the community-based organizations and the patients and their families. And they typically have, or atypically have been starved from a technology standpoint. They don't have the resources. They're not easy to use. Solutions built for healthcare and for payers do a very specific job, which they, and that's not a criticism, but what they need to get done, right? An EMR is a workflow and a building platform. And it's built for that purpose, and it does that job very well, and it's important for those systems and delivery systems or hospitals to get paid and to manage the workflow of the care we receive. But more often than not, the community-based organizations have very little visibility into what's going on, often with shared cases or clients, as they often refer to them, versus patients. And we provide, as an organization, we call it a care hub, which we view as a shared space where all the stakeholders can see the workflow, the job, the priorities, the tasks, the goals for individuals and families, and enable these community-based organizations to receive information on things they need to get done and how they can support a plan of care for individuals and families. And so the big users typically for our platforms on the healthcare side are case managers or navigators who are trying to outreach and connect with these community-based organizations. Obviously, the community-based organizations are big users of our platform. And then obviously individuals and families. Being able to be viewed as a tier one player and member of a team to achieve a specific outcome or goal that I have. The Care Hub provides a way for all those stakeholders to meaningfully engage, get a sense of where I am, manage cases. So we basically give the platform to community-based organizations and families and individuals so they have a way to get visibility into the plan of care and to communicate and coordinate and really see what's happening. And then on the payer and provider side, often, they're driven by workflow, and workflow specifically for complex patients is challenging. And so being able to provide a workflow tool which enables them to easily connect with those other stakeholders is very meaningful, because now you can share as appropriate meaningful information that drives those other stakeholders to engage in the platform, get their job done. In the spirit of Clay Christensen, what's the job people are trying to get done? We're trying to provide a shared space, and often it's a technology where all those players can see each other. We support that technology with a service we call Community Connect, where we have a set of resources which basically work with our partners to help build out their networks and engage with those organizations to help them come on board, to streamline the workflows, to get the metrics in place so that they can demonstrate their value and impact, and in some instances get reimbursed for the jobs they're doing to support these individuals and patients.
Let's talk a little bit about the competitive landscape. How does Activate separate itself from the other referral management technology companies? What are some of the distinguishing factors?
If you look at this space for social determinants of health, we often think about it in a couple of different buckets. There are organizations that are basically resource directories, where they spend time investing and working to develop a network of service providers, community-based organizations that community partners can tap into. So they spend a lot of time thinking about referral management and how do I connect to get a request for services from a hospital, for example, or a payer out to a food bank or to a housing authority. And that kind of electronic directory is kind of the focus of their business. Though there are other players that are focused very much on the data and the workflow. So what data do I need and how do I access the data, and how does that data then inform my decisions? And so like AI and machine learning related capabilities to help people target specific populations. We come from the community coordination side. We're very deep in that space. So a lot of the things that I've mentioned earlier around providing a shared space where a care plan, which is holistic, tasks and activities, workflows around specific interventions to drive the outcomes individuals and families want to see. And then we've augmented that over the course of late 2019 and the first half of 2020 with a referral management capability to stand up the ability to build those networks. So from a technology standpoint and from a services with Community Connect to be able to stand up those organizations. Just to give you an example, we've seen organizations and deployments where you have 1,000 service providers in a specific city. And what you realize or see quickly is that if you have a directory with 1,000 service providers, 10% might get one referral over the course of a project or a program. And then of those 10%, maybe another 10% will get more than one referral. And so we spend a lot of time focusing on who are those kind of trusted, high-impact community partners. And we're fairly agnostic. We have that capability in the platform. We partner with 211s to kind of deliver that resource directory component. As you may or may not know, 211s have been around for decades. They've spent a significant amount of time investing in local resources and building those resources. We actually work alongside the 211s. We're not trying to build the resource directory, which a lot of the other players, the NowPows, the Amberthas, the Unitises of the world, the Alphafis of the world, they're building those kind of directories themselves, and to some degree trying to partner. We come in and say, we work alongside the local 211, we reimburse them, we value them and their contributions, we work with their staff and their organization, and that augments our platform. With that said, we're fairly agnostic. There are cases where somebody has a deployment with these other players. We're an open standard. So what we want to do is get the job done. And so if that means we have to, and we're doing this in some locations, we partner with like a Unitas. We will work with them and are working with them to do the integration such that those resource directories are appropriately shared so that we can track and drive action. It puts it in our name, Activate Care. We're trying to drive action. And we don't have to do everything. We just want to be sure that we do achieve the outcomes that people want to see.
Let's talk a little about the team. The original founders were Dr. Cohane, Dr. Mandel, and Clay. So talk about the original team and where the team is today.
So we started back in late 2012, 2013. We originally were in the Harvard iLab over in Cambridge, or in Alston, actually, over by the Harvard Business School. And the original team was very much focused on doing that kind of simple job, or focusing on the job that I described earlier. And what we've seen over time is that there's a set of, as we've built our partners and grown our team, as we've kind of defined the market, as we've kind of gotten traction with the solution, we've had to scale up and build specific functions, certainly from a revenue team standpoint, people market-facing activities, and then engineering leadership, and then implementation leadership, and people that come more with the public health or the social services or community-based organization lens. And so while the original founders are all still involved and have been actively involved, we've augmented the team with those experts that frankly know a lot more about these topics than I did or I have at the time. And what's been fun is that we don't claim to have all the answers, but we believe we have a very interesting perspective. And we've been able to augment the team with people that have been able to build and complement those skills and capabilities from the clinical side, the community-based organization side, as well as the data analytics sides, right? There's a lot of talk in healthcare, and has been for quite some time. My co-founders, Zach Kohani and Dr. Mandel, have been talking for many, many years about the role of artificial intelligence and machine learning, and there's been it's just been some slow adoption, and there's always this cry for how do we leverage that in more meaningful ways. And so we've been able to push over the last period of time to really kind of help push that out and make that happen. So while often we describe ourselves as a process or a workflow tool to make things happen and drive action for teams, more and more we're trying to say, how do we help with decision support and suggestions and things to drive care forward?
So I'm going to do a little spin on the question you've seen. So what are your plans for the Activate Care, and what would Clay's plans be? Would they be in sync with, you guys had a vision a couple years ago, and where you wanted to be by today, and where are you going to be over the coming years?
Great question.
How does that tie into Clay's vision of what he saw for this company?
Well, what's interesting is, one of Clay's core theories was the job to be done. What is the job that the stakeholders that are touching these individuals and families are trying to make happen? And are you providing the necessary experiences to get hired by somebody to do that job? And that was the question Clay asked initially, and that we continue to ask ourselves. As I mentioned, we don't have to do everything to make that happen. As a matter of fact, we probably have to work and continue to partner with our different stakeholders and partners, both on the technology and services side, to make that happen. But as we move more and more towards this integration of care, if you will, where clinical teams and community-based organizations have begun to work more and more together, we have a kind of firm belief that it's kind of hard to take that genie out of the box, that the evidence base is only has been growing and will continue to grow to demonstrate that somehow we got to do a better job of bringing down the walls and thinking more broadly about how do we deliver meaningful care. And healthcare is a big industry and a big space with significant dollars, and it'll probably take some time, but we fundamentally believe that over time, these types of services and this broader definition of care is going to become more of the standard, particularly for vulnerable populations and individuals that face fairly complex challenges and issues. So as a team, we're always asking ourselves, what's the job we're trying to make happen? And what we're trying to make happen is to meet these unmet needs that individuals have that so often have big implications for the outcomes that we see for the populations or the individuals that we're our partners and we're trying to service and support. So for us, it's all about how do we do a better job of meeting those needs in a meaningful way and driving towards the outcomes that we all want to see. We believe it's technology. We believe it's analytics. We believe it's workflow and process to scale a lot of these interventions that are have emerged and are growing as part of the country, around the country. And then it's the meaningful services to support those stakeholders that have often been so unrepresented in care and turn up the volume to enable them to access plans and drive the services and the results we all want to see.
Well, I want to thank you for sharing your personal story and your entrepreneurial story. I'm honored. I'm a disciple of very few people, but Clay Christensen was someone who had such a major, his import in my life. I think you're blessed to be involved in the company that he was involved in. Thank you for your time, and best of luck.
Thank you very much. We have many shared admiration for him, and I miss him.